Hi Miss, Assalamualaikum and good day. My name is NUR IRDINA DANISHA and I am a third year dental student. Today I will be conducting an oral hygiene instruction. In this session, I will explain about your gum condition, finding of your gum examinations, and also guide you on how to take care of oral hygiene at home. So, firstly, I would like to explain what is periodontology. Periodontology is a dental specialty that focuses on the prevention, diagnosis and treatment of periodontal disease, and also it focuses on the supporting structure of the teeth, which is include the gum, the periodontal ligament, and the alveolar bone, which is the bone that holds the teeth in place. So, if the oral hygiene is not properly maintained, this supporting structure can be affected, and this may lead to the periodontal disease. So, the early stage of the periodontal disease is called gingivitis. It happens when the plaque, which is the soft layer of the bacteria, build up around the teeth. And at this stage, the gums may look red, swollen, and bleed easily, especially when you brush your teeth. But this stage can be fully reversed with a good oral hygiene. And if gingivitis is not treated, it may lead to the periodontitis, which is more serious. This because in periodontitis, the infection starts to affect the bone that supports the teeth, and can cause the gum to pull away from the teeth and form the deep spaces or pockets where the more bacteria can collect, and the damage is not reversible. So over the time, the teeth may be loose, which is mobile, or even be lost. And now let me explain some factors that can affect the gum health, especially in your case. So one of these factors is diabetes. And from your medical history, I understand that you have type 2 diabetes and currently on medication. So even when the diabetes is controlled, it can make the gums a bit more sensitive to infection and slower to heal. This does not mean anything serious will happen, but it does mean the extra care with oral hygiene is important for you. So with a good cleaning at home and regular dental checkup, we can manage this well. So based on the gum examination and dental x-ray, we found that your gum condition is affected in some areas. There are deeper gum spaces and signs of inflammation, which is there are bleeding or probing, especially around the upper front teeth and lower back teeth, while other areas of your mouth are in a better conditions. This tells us that you have gum disease that is localized, meaning it affects at certain area rather than the whole mouth. So you don't have to worry, because this condition is manageable with a proper treatment, good daily oral hygiene, and regular dental visits. And we can control the disease and prevent it from getting worse. So how we practice a good daily oral hygiene? Right now, I'm here with my oral hygiene kit, and I will start with the toothbrushing technique first. So for the daily brushing, I would recommend you to use the modified base technique, as this is one of the most effective methods to remove the plaque around your gum line. And firstly, I would like to advise you to use the soft bristle toothbrush, because the hard ones may injure your gums, and over the time it can cause the gum recession. So for this technique, you should have your toothbrush at a 45-degree angle to the smooth surface of the teeth, and the bristle should be angled towards the gum tissue. Like this. Okay. So in this position, there should be a vibratory motion, like the short back and forth, stroke slightly, circular motion. So this can help to remove plaque from both the tooth surface and just under the gum margin. And make sure, don't forget to brush the outer surface, the inner surface, and also the chewing surface. And you should brush at least 2 minutes twice a day, especially before you going to bed. So moving on to the flossing technique, there are 2 types of floss, which are the first one is the floss trader, and the second one is the floss holder. And let me show you the first one, which is the floss trader. First, we take about the 18 inches of the floss and wrap it around your middle finger, and to make sure it's stable, hold it with your index finger, and then gently slide it between your teeth and in a C shape. And move the floss up and down to remove the plaque, and like that. Can you see it? Do this once a day. More prefer before the bedtime. So for the thread holder, same, just gently slide it. Sorry. So next is the interdental brush. Interdental brush are very helpful if you have a gap between your teeth. So interdental brush have multiple of size, so you have to pick the size that fits you comfortably. So when to use, you can use at the between gap of your teeth, and then you can move forward and backward to remove the plaque. Okay. And also not only at the gap of your teeth, but also at if you have a missing tooth, you can also use the interdental brush. And if you have a furcation, you can also use the interdental brush. And also if you have bridge, you can also use the interdental brush to clean it between it, so to make sure that there are no food debris or a plaque. So beside a regular toothbrush, there is another very helpful oral hygiene aid called a single tufted toothbrush. A single tufted toothbrush has a small round head with a single bundle of bristle. Because of its size, it carries area that normal toothbrush may miss, like this. We usually recommend a single tufted toothbrush for cleaning around the gum line, especially in hard to reach area, and also at the back teeth, and crowded or rotated teeth, also around the orthodontic appliances such as braces, and around dental restoration like crowns and bridge. This we have bridge here, so we can use. How to use a single tufted toothbrush. First, we place the bristle gently at the gum margin of the tooth at a time. We use a small circular or gentle vibrating movement similar to the modified base technique, and clean carefully around each tooth, especially area that difficult to access with a normal toothbrush, and do not apply too much pressure, just gently. So next is mouthwash. Mouthwash is not like a substitute for a brushing or flossing. It works best as an additional step after proper mechanical cleaning, and it is not compulsory. It can be used if it needed. So the benefits of mouthwash: it helps reduce plaque causing bacteria, and it also can help reduce the gum inflammation, freshen breath, and some mouthwash contain fluoride, which can help prevent the tooth decay. So after we already take care of oral hygiene at home, it is also important to understand the role of professional dental treatment, especially scaling and root debridement. So even with a good brushing and flossing technique, some plaque can harden over time and turn into calculus, also known as tartar. So once plaque becomes calculus, it cannot be removed at home. That is why scaling and root debridement is needed. So let's talk about scaling first. Scaling is a procedure where the dentist remove plaque and calculus from the tooth surface, especially around and below the gum line. So this helps to reduce gum inflammation, bleeding, and also bad breath. And the next one is root debridement. Root debridement involves cleaning the root surface of the teeth to remove bacteria and toxins. It also smoothens the root surface so the gums can heal properly and reattach the teeth. So to improve your gum condition, treatment is done in two ways. First is home care, which is your daily brushing and flossing, and the second one is a professional treatment where the dentist will do a deep cleaning called scaling and root debridement to remove hard deposit under the gum. So after the treatment, healing of the gum is very important. So if diabetes is not well controlled, healing can be slower and gums may remain inflamed. That's why controlling your blood sugar and keeping your mouth clean go hand in hand. So however, after scaling and root debridement, there are some common and temporary post-operative effects that you may experience. These are normal and usually improve within a few days. The first one is tooth sensitivity. You may feel sensitivity to cold and hot, and this happens because the roots of the teeth are more exposed after the gums healed. And the second one is the spacing between the teeth, because the plaque is already removed. And the third one is the gum recession. So I think that's all for today. That's all for my oral hygiene instruction. Thank you, Miss, for listening.